Finding innovative ways to improve disease detection and treatment response time can have a profound effect on patient outcomes. Annalise AI are working with NHS clinicians and hospitals to implement their AI tool for medical imaging. It assists radiologists to detect over 100 pathologies, becoming a second set of digital eyes.
More than 4,000 people in Scotland die from lung cancer every year. With increasing demand on medical imaging and capacity constraints, some hospitals are turning to emerging technology for help.
Lung cancer has got very poor survival rates, so it's about 15% are still alive for people who've been diagnosed with lung cancer 5 years later, versus 85% of people with breast cancer. One of the reasons for that is we can't identify lung cancer early enough, so it's asymptomatic.
Tested and created with the input of world-leading radiologists, Annalise Enterprise is a comprehensive artificial intelligence software that analyses chest x-rays for over 100 findings within seconds of being taken, and is an assistive tool for clinicians. NHS Grampian has been at the forefront of groundbreaking research in the medical science space over the last 6 years, and the Innovation Hub has partnered with Annalise AI. Now that relationship has been welcomed by both doctors, nurses and radiographers right here in Aberdeen.
One of my colleagues was reporting and he initially was saying that the chest x-ray was normal. He came round to me and he says, actually Annalise has flagged that up as a potential mass. I've re-looked at it and now he's re-reported it. Patient had a CT scan 2 days later, which confirmed lung cancer. So literally within 3 days of it going live.
There's a big drive from NHS Scotland, NHS England and elsewhere is to really improve detecting lung cancers early, because the earlier you can detect them, the better the prognosis is. So where Annalise is helping is finding those really early, subtle, small lung cancers or potential lung cancers.
Decision support tools like Annalise are anticipated to help reduce wait times and time to diagnosis for patients.
If we can then flag if there's something that needs further investigation, like a potential lung cancer, whilst they're still in the hospital, and instead of having to travel back and forth, we can get them onto a CT scanner. And that way your time to actually diagnosis is so much quicker, and you're likely to be picking up these cancers at a much, much earlier stage.
NHS Grampian are the first UK trust or health board to use this AI decision support solution outside the radiology department at the crucial point of care.
It's an extra pair of eyes for us, and that's very welcome on a really busy ward round. I find that you fatigue a little bit less, and even by the end of the ward round you're still performing well because you haven't sort of expended all your energy and your concentration and your stress levels on the first few.
The NHS long-term plan aims to save thousands more lives each year by dramatically improving how they diagnose and treat cancer. The Annalise AI technology can help support the national effort to detect cancer early, and NHS Grampian is leading that path.
Our big challenge really is identifying people who need the quickest help and have the most serious conditions, and it's very difficult for us to do that at the moment. I think products like Annalise AI and other artificial intelligence products will help us prioritise and risk stratify.
The AI flags chest x-rays that have critical findings to help signpost doctors to patients with the most immediate needs.
The comprehensiveness of Annalise means that we can find over 100 findings on a chest x-ray, which means that no matter where it's used, in what clinical setting, it is able to find the relevant things for those patients. And the importance of that is in triaging and prioritisation. So they prioritise the patients that have findings that need immediate attention, and that way we can then, allocate the resources better and improve efficiency, making sure that people get treated when they need to get treated.
For doctors, embracing technology and staying abreast of the latest innovation in medicine are what they think can help patients and the staff at NHS Grampian.
AI is here to stay. I think for a lot of people they're a bit hesitant about it because they see the potential risks associated with it for, is it going to replace me? I would say that's not going to happen. It's here to help and it's here to support.